Hello, everybody. This is Andrew Hiscott here. We're delighted to have Dr. Christof Loose on the call with us today, who's going to talk to us a little bit today about schema therapy and also some upcoming training that we've got, which we're very excited for the fact that Dr. Loose will be coming here in person to Singapore to do a 2-day training in February of next year, which we're going to talk to him about. So good morning, Dr. Loose.
Hey, Andrew, nice to see you. Thanks for invitation.
Not at all, not at all. Christoph, I thought we'd first of all start off by asking you a little bit about schema therapy. So obviously you're an expert and you've got a book that you've written about schema therapy for children and adolescents in particular. A lot of questions we get from students within the psychology and counseling community and psychotherapy community uh, is is about CBT and its relationship with schema therapy. So a lot of people feel CBT is obviously well known and it's known as a very effective modality. When we talk about schema therapy, what are the sort of key differences and drivers that make schema therapy more efficacious, perhaps, than other modalities?
So I think schema therapy is actually an enhancement and further development of cognitive behavioral therapy. So CBT is great, and really I'm a therapist in CBT as well, and I'm really fond of. But at the same time, we also work with clients who cannot benefit from the CBT approach alone. So it's good, but not enough for them. And what schema therapy provides is a more profound or more in-depth approach, especially to the emotions and the body reactions and to the schemas which result from the biography. So it's more than cognitive work. We are actually heading for the emotions which are beneath, and yeah, that is a more in-depth psychotherapy actually. So when CBT is not working, we might think of schema therapy.
Okay, it's great to hear. So we're delighted, obviously, to have you coming over here in February of next year. And for those of you who are watching this, you can look at the links on our website to find out more about that training. We've got a 2-day workshop with you, which is focused on adolescents and young adults. So tell us a little bit about the highlights for that training that you anticipate being able to share.
Actually, this workshop is designed for therapists who work with 15 till 25-year-old clients. So this is a special age because actually, well, they are not children, but they are struggling with all these skills and functions or expectancies they are facing as an adult, as a young adult. So many clients need some support in finding themselves, finding their track, their goals, finding their identity. And some of them are still struggling actually with their basic emotions. So for example, how to deal with my angry mode, or my anxiety, or my vulnerable child mode. So that is definitely a part of our training, that we look, how can we support our clients on a more emotional level, especially how to deal with a vulnerable child mode within them. And this is one important highlight, actually, that we find a way to support a young adult vulnerable child mode. But beside that, we also want to enable them to have some insight on their inner stage so that they become familiar with their own modes, with their inner stage, so which parts are relevant. And we provide a simple system, a case conceptualization, where they can better understand what's going on my inner stage. So we have this mode sketch, what we practice. We will see how the case conceptualization is working, and especially how to support the vulnerable child in order to find some adequate ways to cope with difficult situations. Yeah, we also have some imagery exercise, and beside that, we have a lot of demonstrations. So I will be assisted by my partner, Andrea. She is actually playing a client, 20 years old, so with complex emotional needs, I would say. So it will be a kind of performance of training, but you will also have the opportunity to give it a try by yourself. So it will be a interesting program. I can promise that.
Fantastic. We're looking forward to it. Obviously, you've trained people out in Asia before, and we've had the privilege of you training many clinicians here over the last few years. Do you see any cultural differences for how adolescents and young adults need support in Asia versus back in Europe where you're from?
Interesting question. Actually, well, every client is different, but if you ask me for a general impression, is that I sense a certain insecurity or how to deal with unpleasant emotions, or with the openness to express them to public. So what I sometimes sense in Asian countries is that they think emotions is a private thing, and it's not. I'm not entitled to show my emotions to other people. So it's something I have to do. I have to clarify with myself. And that might be a problem from our point of view, because we are sometimes frustrated and angry, or we are hurt by something. And this might be tricky for someone who has learned all lifelong behave and control your emotions, and they are difficult to control always. So what is a good way actually to express my emotion but not offend the others or to overload them with my emotions? And that might be a tricky thing when in Asian countries, let's say, people have to function, have to be successful, and have to be powerful, and maybe they need some support in finding a good way to express emotions, which are maybe unpleasant, but nevertheless have a reason, or they have a right to be there.
Yeah.
This is maybe in Western country, maybe they need to learn to regulate a little bit their emotions. Maybe I'm not sure, but yeah, that is a topic. What's the right way to deal with my emotions and my needs?
Okay, very interesting. And will the participants who attend the 2-day training with you, will they have a chance to practice and use some of the skills that you and Andrea will be showing them?
Yeah. So usually I try to explain a little bit. So it would be good if participants have a basic knowledge in schema therapy. That would be helpful, because the focus is on techniques and how to apply them. So I will explain a little bit, we will demonstrate it, and then you will have some time to give it a try on yourself. Yeah,
Okay, great. And who can attend the training? So what level of experience and understanding do they have to have of schema therapy, training in schema therapy, or reading around the subject? What's the expectations there?
Yeah. So actually, I'm looking for therapists or counselors who work with this group of clients, so 15 to 25, and yeah, have some experience, for example, in CBT, but could be also psychodynamic approach. So, but they are already trained in psychotherapy or counseling, and yeah, and actually, all those who are interested, actually, there's nothing you can do wrong here, actually. So if you have some knowledge in the main concepts of schema therapy, like the schema model, the mode model, the need model, that would be really helpful and makes it more understandable what we then practice. Yeah.
Okay. And I've got one final question, Chris. So do you see that schema therapy can be more effective with this age group, the 15 to 25-year-olds, than it can be for the older population and for the younger population? So how effective is it in that adolescent, early adult group?
Yeah. So we are still in our kinder shoes when we talk about schema therapy for children or adolescents. For adolescents, we have some empirical data, but mainly was externalizing problems like aggressive behavior and so on. So I cannot convince you with RCT studies. So, but the research, well, the experience is that we are actually more successful in building up a relationship to our clients and actually get them involved, get them as an active part of the therapeutic process. And since we are looking for bridges between the present and the past, we would actually go deeper than we usually go in CBT. So we try to understand the roots of a certain problem or a certain phenomenon and try to go back and try to, well, reprocess emotionally what happened in the past. And that is a great benefit and helps the clients to not only to learn a certain behavior, but also to stick to it or to get used to it. And so, but there's no empirical research that I can prove that it's working for teenager. For adults, for sure, we have some empirical data that this approach is more powerful or very powerful. But for younger clients, we are still in our kindershoes and need some more research.
All right. Well, I know you've written a fantastic book, which I hope those who are watching this video have a chance to read, and perhaps if they do attend the course, then that's a great read for them to understand more about the schemas and the modes and so on, particularly for the younger generation. So we're absolutely delighted that you're going to be coming over in person in 2024. It's been a little while since you're passing through this neck of the woods, so we're honoured that you can stop off and see us in Singapore. So we're really looking forward to that, and having a 2-day course with you and Andrea, which I think people will get a tremendous benefit from. So with that, Christof, we'll thank you very much, and we really do very much look forward to seeing you in February of 2024.
Thanks so much, Andrew. I'm also really fond of visiting you and seeing you all in Singapore. Thanks so much.
Great. Thank you, Christof.